Hi, my name is Dr. Arthur Mark. I'm a Board Certified Orthopedics Surgeon. I'm on staff at Jersey Shore University Medical Center and Ocean Medical Center. So outside the hospital, right now I'm really busy because I have two small children at home. I enjoy the Jersey Shore area, and I'm very involved in a lot of charity and committees within the hospital. CV Orthopedics takes a lot of care in doing a lot of charitable events around the calendar year, from whether it's Big Brothers, Big Sisters. We do hospital benefits. These are things that keep us busy throughout the year. And you know, outside of the hospital, my personal life, I really enjoy being at home with my family and my kids. Monmouth and Ocean County, we're very fortunate to have a very nice kind of standard of living or area to live in. We have the Jersey Shore that's beautiful. People in this area are pretty well-to-do. And believe it or not, the healthcare in this corridor is very good. Because we're so close to Manhattan and Philadelphia, people expect a higher level of care. And I think Meridian in this area has been able to live up with that. And I tell most of my patients, there's no need for you to head up to Philadelphia or New York to get joint replacements done. You can stay here at the Jersey Shore and get just as good care. I see patients that come back to me for their second knee replacement after they had one in New York and said our care is just as good as anything they could do outside this area. My advice to keep people that are starting to have some troubles with their hips and knees, to keep them nice and healthy, is number one, exercise as much as you can. The low impact activities can really work on strengthening your muscles and keeping your joints mobile as they get more stiff. The other major thing is to keep your weight down. I think one of the big problems today is as people are getting heavier, they're putting a lot more stress on your hips and knees, and this has been accelerating the arthritis process. Traditionally, when you do a knee replacement, you have to kind of open up the knee to get inside. And what we traditionally used to do was cut the quad tendon down here and basically create a window to get inside the knee. With the minimally invasive techniques now, I'm taking less muscle and really coming across just from the bottom here down. So we slide the kneecap over instead of flipping it all the way around. This way, more of your muscle is still attached, so after the surgery, you have better strength and range of motion. So here's a model of a hip replacement, and this shows us that as you become arthritic in the hip joint, we actually remove the hip joint and replace it with a metal prosthesis, which goes into the acetabulum and has a thigh piece that goes into the femur bone. This implant is machined and put inside the femur bone and assembled, so now you're walking on the metal and plastic prosthesis.